Right, my name is Brett Edwards. I am a Master's in Sports and Exercise Medicine student. This is my hip assessment for Module 3, the module assignment. My colleague will be helping me out today. So let's begin. Typically I like to begin with the assessment as they walk in, just an observation, how they're walking, what their foot position is like, what their knee position is like, any genital varus or valgus, any bruising or scarring, just an observation, and then get them walking. So typically if you could walk forward, and then turn around and walk back to me. Thank you. Assessing if there's any limping, any imbalances that I can notice, or anything like that. Next, for the hip, we will do a hop test. So standing on one leg, you can just hop. Good. And relax. And that we're just looking for any indication of any stress fractures or any acute injury. Next, we're going to do a squat and a lunge. So if you go into a squat, good, and then no pain or issues there. Then we'll go into a lunge. Good. Other leg. Good. And again, we're just comparing left and right, what's normal for her, and notice any other imbalances you may find, any internal hip rotation indicating a bit of decreased activation in the glute medius. Just looking for tips and clues on where to possibly go with your assessment. Next, we will do Trendelenburg sign, so if you wouldn't mind turning around. Yep. There. Typically I would undress the patient to make sure that you can see all the various landmarks, but for this evaluation this will be good enough. So I'm going to have you, I will search for PSIS on either side. Okay. Can you lift your left knee to 90 degrees? Left knee, that's it. Good, and down, and right side, good, and down. Typically you're looking for any drop in the side that has been raised, which would indicate poor muscle activation of glute med, glute min, and possibly the adductors on the standing legs. Okay, if you wouldn't mind sitting. Next, we'll do a fulcrum test to assess the neck of the femur for any fractures. So I will take my hand under her femur and place it on top of the other leg, fairly high up, and from there put downward pressure onto the knee and assess if there's any neck or femur pain or pain in the hip. We'll go into, can you lay on your back with your head on that side, please? Can you hear on this side? Okay, so in supine, we'll look at assessing the hip. So I'm going to start off in 90 degrees. Just go through internal and external range of motion. Any pain with that? Any pain with that? And then assess it and compare it on both sides. Next, I will go into flexion with adduction. Initially medially and then gently working my way out more laterally. With Oger's test, and then just circumduction, seeing if any of the structures within the acetabulum, any labral tears or any impingement, any FIA, FAI, or any of those tests are positive. Then we're going to do any leg length discrepancies. So if I can have you lift your hips up and go back down, good. So typically I like to get them to do a bridge to just get rid of any unevenness and then assess the knee position. So if one tibia is slightly longer, you'll see a slightly higher knee on one side, or if one femur is slightly longer, you'll see a slightly more anterior knee compared between left and right. We'll go into a straight leg raise. So I like to do this passively and actively. So if you keep your legs straight, can you please lift it up? Good. And then compare to that side. Good. They're both fairly equal, quite close to 90 degrees. Again, just looking for any neurological signs or symptoms that may be present passively. Any pain or discomfort there. If that's all negative, add some dorsiflexion with medial rotation, and still negative. And then compare to the other side. While she's here, palpation of the soft tissue, typically over the anterior of the hip, so you're looking at ASIS and AIIS for sartorius attachment, as well as rectus femoris attachment. So palpation of those areas are quite important, what those tendons feel like. Into the inguinal ligament, making sure that's feeling fine. Palpating the conjoint tendon. And then as well as going under the inguinal ligament and trying to palpate for the psoas tendon. So take a deep breath in and out. Good. And that just helps you get into the psoas tendon. Again, you're comparing the left and right and looking for any indication of pain. So from there, well, if I can have you sitting up, please. You can come sit here. We're going to go into a modified Thomas test. So, standing up. Good. And then just have a seat on the bed. Good. And now from that position, you can roll onto your back, hug your knees to your chest. Good. I like to position the sacrum in a neutral position. Okay. Don't move that leg, just hold on to it, and this leg can just relax down to the floor. Good. And then from the lateral position, assess where the quad is, what the quadriceps length is like. And she's pretty good there, going past the vertical, as well as having the knee at 90 degrees. So there's no quad length issue. The hip flexor issue is not there either, and there's no lateral shift either to indicate that the ITB may be a bit tight. And then again, comparing left and right. Okay, so you sit up. Okay, you can lay back down, please. Thank you. Next we'll do Faber's test. You can use this one in the assessment of SOJ pain too. So just looking at with a bit of overpressure, assessing if there's any pain there. If there is pain, asking where the pain is, just to allow her to tell me either feeling it over the SIJ region or within the hip without guiding her into where the pain is, and then further assessing that from there. Next, we'll do Irwin's test. Laying on your left hand side, please. And come back all the way to the edge of you're going to hug into your chest.
This one?
Yep, that one. Hold that. Yep, just like that. Good. Okay. Then from here, I will typically put a foot on my hip and support the leg. 1 minute. And then from there, I'll stabilize the pelvis and extend it. And then allow it to fall. And then it should typically go beyond the level of the bed, but she seems to be a bit tight in the ITB. Thank you very much.
Yeah.
So that completes my hip assessment. Thank you.